So this is a news article that was in The Guardian that a lot of you have tagged me in over the past week or so. And it's astounding. Alabama woman with 2 uteruses, I don't know if that's right or if it should be uteri, is pregnant in both wombs. Now, this is actually pretty rare. So she's 32 and she's having twin girls, and one is in each uterine horn. I haven't, let's see, I can look up what the actual incidence of that is. So when I drew the photo earlier of didelphys, that's what this person has. I'm assuming, yeah, so here we go. Uterine anomaly called didelphys, or 2 uteri. She was not diagnosed until last spring. Oh, so she was diagnosed when she found out she was pregnant with one in either side. He said, no, you're lying. I said, no, I'm not. I mean, most of us who found out we were pregnant with twins would say that in general. Uterine didelphys affects 0.03%. That's a fairly low incidence rate. Although I feel like I've seen it several times, and that's really, really low for how many times I've seen it, but who knows? Maybe that's a selection bias. Abnormality forms in female embryo early in development, around 8 weeks, according to fertility researchers. So the fact that both ovaries ovulated at the same time or around the same time is pretty astounding. That is pretty astounding. And for both of them to be fertilized and successfully implant in separate sides is pretty amazing. I have cared for many patients with 2 uteruses and 2 cervixes, and it's oftentimes challenging to induce labor with 2. Yeah, that is a problem because sometimes you can't get the right cervix to dilate, but most of the time, as long as there's pressure on the cervix from the baby, it will dilate. Would it be possible to go into labor on one side and not the other? No, because labor is mostly a hormonal and yeah, you might have better dilation on one side, but they would both be in the same hormonal environment. But it would be potentially really difficult to deliver vaginally. I've never heard of somebody delivering vaginally with twins, one in either side. And they may be born even days or hours apart. Yeah, so it says they may independently go into contraction. That's probably true, but I would think like days or hours apart would be more because one cervix is just not dilating as efficiently. I would really question if you would be having separate contractions, because contractions are hormonally influenced. I don't know that I agree with that, but this is rare, so I don't know that I have much to say that I disagree, other than I just don't know if that's quite right. Someone said that's 1 in 300. That's not exceptionally rare. That's true. Yeah, that makes sense. You didn't know I was pregnant episode on this. She had a miscarriage in one and stayed pregnant in the second. Oh yeah, I remember that. Oh gosh, I completely forgot that. That was one where the patient had been pregnant in either side and had a miscarriage, but didn't know that they were pregnant in both sides. So then when they miscarried, there was one still in the other side, and that's why they ended up not knowing that they were pregnant. I'm glad that you said that. I forgot that happened. I'm gonna look up, see if I can find any information on pregnancy in both sides. So let's see, we can look on here. Talk about, so these are some of the various classifications that they use for uterine anomalies like we were talking about. So I've never really been taught to put them into classes like this, but you can see all of the various types. So this is one of them we were talking about that was unicornuate with a functional or non-functional rudimentary or underdeveloped horn. You can have aplastic uterus, so not have a uterus at all. That's called MRKH, or Mullerian agenesis. You might have heard some people talk about it. These people will have normal ovaries, so they can still have an egg collection and a gestational carrier, because the ovaries do not develop from the Mullerian system. So sometimes they don't have a uterus at all, and the vagina will be a blind pouch. It just ends at the top, and they may go their whole life without knowing that either, except that obviously they wouldn't have periods. But if they never get evaluated for why they're not having periods, and they just assume like, I know it sounds insane that people would do that, but it's truly like some people just think like, I don't know, it never happened. So I just thought that was my normal. They might not find out until way later in life that they didn't have it. I was just wanting to see what they said prevalence was. So prevalence of any kind of congenital uterine anomaly is 5.5%. Higher in patients who have infertility or history of miscarriage or both. So 25% of patients with miscarriage and infertility have a congenital uterine anomaly. In a literature review, frequencies of specific anomalies were didelphys 8%. So of the population who is affected, which is, what did they say? 5%, so 5.5%. Of that 5.5%, 8% are didelphys. Just talks about all the development, like the different ways that it happens. Talks about things that you can get from it. So hematometra is where the cavity of the uterus fills up with blood. That would be because it can't get out for some reason. So that's more common if you have like a rudimentary horn that is underdeveloped, but it has uterine lining inside it and there's no connection to the vagina or to the other uterus for that blood to get out. You can get hematocolpos, where the blood just pools in the vagina, and that is usually because of a lateral septum. So I was just saying earlier that an imperforate hymen wouldn't be considered a Mullerian anomaly, but you can also get a lateral vaginal septum, which is kind of part of this development process, and that can cause that hematocolpos, which is really similar to how they present with a imperforate hymen. It would be like clinically the same, just the location is a little bit different. Pelvic pain, abnormal bleeding, they have been associated with miscarriage, preterm birth, preterm rupture of membranes, growth restriction, malpresentation. This is odd. Pregnancy associated hypertension. How would that happen? I am so... Don't know. That's fascinating. I would have to look into that. Rupture of a rudimentary horn. So this is really dangerous because they are muscles that are highly vascularized. So if you get pregnant in one side and don't realize that it's a underdeveloped horn, they don't stretch as well as a normal uterus because they don't have the right configuration. And it's essentially an ectopic pregnancy. So as it develops and that uterus that's underdeveloped can't develop with it, you can get a rupture of that, which is really dangerous. I would say for the most part, no matter what the anomaly is, the most common problem that people experience with a congenital uterine anomaly is malpresentation. So a baby that is transverse or breech is probably the most frequent complication. So it is associated with all of these things. And this is why it's always really important when we're talking about like risks and statistics and stuff to go over like absolute and relative risk. The absolute risk of all of these is still quite low, especially the really scary ones like recurrent miscarriage and things like that. But the relative risk compared to someone who has no congenital uterine anomaly versus someone who does is higher. So this association just means it's higher in people with a CUA than people who don't have it. No real discussion about pregnancy in both horns. So didelphys. Generally, duplication is limited to uterus and cervix. Oh, I don't know if we can show that, but that's what it looks like. So cervix, this person has one cervix, but you can see that one cervix goes into two separate uteruses. That's a hysterectomy specimen. There you go. That's two cervices. So that's, you can see how that may not be easily seen. Like if you're just doing a quick exam, you might not notice that that's what you're seeing. And same thing here. So this person has one cervix, but the two separate osses. So the cervix, you might not see that. I mean, this is really, I think people sometimes hear this and go, how could someone miss that? But it's not actually that hard to miss. I think I lost like 15 people. They were like, nope, that's too much. Don't show pictures. Yeah, no real discussion of what the pregnancy in either side incidences. I feel like I've seen it once. I wasn't primarily caring for the patient, but I do feel like we had somebody who had a didelphys with a pregnancy in both horns when I was in training. It's like ringing a bell somewhere in the very, very back of my brain.